some of the greatest, most impactful healthcare changes that you have seen in your career? And give us your thoughts on those.
Well, I started when Medicare and Medicaid began. And that was the biggest change. Everybody was concerned. It was socialized medicine, and the government was going to take over. And really getting adjusted to the program. We started out as hospitals getting quote, Medicare-defined costs plus 2%. Then it went to Medicare plus 1%. Then it went to just Medicare costs. And then they started redefining cost and continually reducing. And then the update factor replaced the cost factor. And we ended up getting less and less than our actual cost increases over time. And that ultimately, in 1982, transformed over into DRGs. Now, that did change the incentives for hospitals, but it wasn't aligned with physicians or others in the healthcare system. And as a result of that, we had an imbalance. Now, some hospitals actually were able to manage and benefit from DRGs. Others didn't and actually lost. But over time, everybody adjusted to it, and now it's a way of life as our outpatient APGs, and of course Medicaid, Medi-Cal has converted to DRGs, and that's now as common as it was on a just bill charges basis back in the early years. I think those were really significant. In 1972, we had PSROs and what were called Section 229 limits on capital, and also then we had health planning established with health planning agencies. Those had a big impact. And then after 82, we went through a series of things that impacted. We had the HMO Act, we had other changes. We went to PROs, and then of course we had the 90s with the emergence of managed care and the fallout that occurred. Actually, there was fallout in the 70s in HMOs in California that were primarily Medicaid. So we learned very little there, and then we kind of repeated those again in the 90s. But moving into the 2000s, we'd picked up Medicare Advantage, so that gave us a little bit of a buffer on just ratcheting down payments. Hospitals have done reasonably well considering the incentives in that program. Then we hit MACRA after the ACA. As I look back over the entire 52-year period, while Medicare and Medicaid did a lot on the coverage side, I think the ACA has put into motion many more things that have a more profound impact on the system than did just coverage of Medicare and Medicaid. For example, the so-called pay-for-performance to value-based purchasing and the so-called volume to value, healthcare-acquired infections, readmissions, all of these things that have been cranked in, and then ACOs attempting to move people into, quote, managed care. But on the other hand, if people can drop in and out of it, you can't manage them. So there are many, many inconsistencies that have developed because people that don't understand the system don't connect the dots. And they will look at 2 dots and say, we're going to do these 2 things, not knowing that the impact on 6 other dots is really important to the provision of health care. And then, as was said this morning, MACRA will have a big impact. What it ultimately does, we're unsure of at this point, but I think it is clear that we are moving in a direction as a result of the ACA and MACRA that is going to be more compressed than we have seen in the past, because we went from basically from 1965 to 1982, and then from 82 into this century before we saw significant changes in fundamental cornerstone policies. but they're going to come much faster now.
Great. You stimulate for me another Dwayne conversation when you identified the challenges around payment reform or payment methodology, and your constant conversation at the board about when we get into delivery care model change and redefining the care delivery model, your message is it always starts with payment reform. And that's pretty much what you just described in terms of your experience.